Hi everybody, Dr. Michael Nusbaum here on Health Talks. Today we're going to be talking about medical weight loss versus surgical weight loss, specifically bariatric surgery. So let's start off with the risks, benefits, and differences and why you should choose one over the other. So losing weight. In surgical weight loss, yes, it is going to be much more rapid. Typically, I see 20% of a patient's excess body weight coming off in the first month, and then probably about 10% each month afterwards. So it is not uncommon to see 100 pounds of weight loss in 9 months. Medical weight loss, it is a much more gradual weight loss. Now, we do have medications like semaglutide and tirzepatide, which will accelerate that. And we do have some aggressive programs here in our practice, like the genetic diet, where it's a rapid weight loss, 20 to 40 pounds in just 2 months. But that is not sustainable, which is why you then switch into a medical weight loss program that's a monthly program, and then the weight loss is more gradual there afterwards. So the weight loss in the end, you couldn't lose a similar amount of weight with a medical weight loss program as you would with a surgical weight loss procedure. It's just going to take more time, and it may not be exactly as much, but it's certainly not going to be as rapid in the beginning. So weight loss can be comparable. I would just say caution that with it's probably going to take more time with a medical weight loss program. Next thing. Is it permanent weight loss? Well, the real answer is neither are permanent weight loss. Even with bariatric surgery, you can gain the weight back. How? Well, you go back into your bad habits, eating things you shouldn't be eating. I mean, you could literally melt down a gallon of Haagen-Dazs ice cream and eat it and drink it, and it's not going to be restricted. So if you're going to fall back into your bad habits, surgical weight loss is not a permanent weight loss. Now, medical weight loss, same thing. We all know that, the yo-yoing of diets, gaining and losing weight. In order to be successful in a medical weight loss program and keeping the weight off long term, you need to be seeing a medical provider who has a comprehensive medical weight loss program with registered dietitians, but also to give you answers as to what you should and shouldn't be eating long term. So they need to be able to provide you with a diet going forward that's tailored to your body specifically so you don't put the weight back on. If you're not doing that, you're just getting the medications online or online provider or a provider who doesn't even do medical weight loss, you're not going to be successful. You're going to lose the weight, but you're going to gain it right back. So my advice is, once again, to see a healthcare provider who specializes in medical weight loss, who can give you answers as to what your diet should be going forward so you don't put the weight back on. Next, downsides. All right. There are risks to surgery. So on the surgical end, yes, there can be anesthesia complications, there can be surgical complications. So you do have risks of surgery with any bariatric surgery program. What are the risks with, or the downsides to medical weight loss? It's a weekly injection. That is a downside. Some people don't like that. There are pills that can also be provided, but my experience has been those pills don't have the same bioavailability, so the weight loss is not as good with the pills, but that's for now. That could change in the future. Next, side effects. Well, those are kind of similar. It's really nausea and vomiting for both a semaglutide or tirzepatide program and for bariatric surgery. You can also have some pain, discomfort with bariatric surgery that is not associated with the medical weight loss, although some patients have experienced abdominal pain and cramping and even end up in the emergency room. So kind of comparable, but I would say medical weight loss wins on that one. Complications, surgical complications. They can be life-threatening. There's no question about that. And it all depends on the provider you're seeing, the surgeon that you're actually seeing, their experience, the number of cases they've done, their success rate, their talent as a surgeon. So my advice always is to patients to find a friend who's a nurse or call up the hospital and ask them about a certain bariatric surgeon. They'll tell you the truth, and they usually know because they work with us all the time. So the best way to find out is to find out somebody who knows the surgeon. On the medical end, honestly, the risks are minimal. You can, if you've had a history of pancreatitis, get pancreatitis again, but your provider should be asking you if you had pancreatitis and should not be giving those medications if you've had that. But there can be other issues. There's some reports of, patients who've had previous issues with their gallbladder, that being exacerbated a little bit, not caused by the medication, but could certainly, in some instances, exacerbate a pre-existing gallbladder condition. Otherwise, risks on the medical weight loss side, pretty minimal. So when you're going to make a decision, you have to think about several things. 1, risks and benefits. 2, neither are going to be permanent. 3. Honestly, if you're not looking to lose more than 100 pounds, I would say try the medical weight loss first, see how you do with it. As long as you're with a healthcare provider who's got a comprehensive program, you can be very successful. If you got more than 100 pounds of weight to get off, you got to decide one or the other. What are you looking to do? There are patients who've said, look, I've tried semaglutide, I've tried tirzepatide with a provider who has a comprehensive program. It wasn't successful. That is the patient who should definitely be thinking about bariatric surgery. So, when it comes time to make a decision, make an educated decision about the provider you're going to see. If you're seeing a surgeon for bariatric surgery, weight loss surgery, you need to find out how good they are and ask around. If you're looking to see a medical provider for medical weight loss, go to a specialist in medical weight loss, not just a doctor who's dabbling in it because they're trying to add to their practice, and certainly not somebody online and you have no idea who they are and you're not even sure what kind of medication you're getting. So do your homework. You will be successful. I know you will. But just remember, there are options out there for you. As always, Dr. Michael Nusbaum here on Health Talks. We're happy to help you and answer any of your questions. Good luck.